Hi, it's Jamie, Progressive's Employee of the Month, 2 months in a row. Leave a message at the... Hi, Jamie. It's me, Jamie. I just had a new idea for our song about the Name Your Price tool. So when it's like, tell us what you want to pay, hey, 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 and the trombone goes, blah, 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 and you say, we'll help you find coverage options to fit your budget. Then we just all do finger snaps while a choir goes, savings coming at ya, savings coming at ya. Yes? No? Maybe? Anyway, see your practice tonight. I got new lyrics for the rap break.
Progressive Casualty Insurance Company and Affiliates. Price and coverage match limited by state law.
Blog Talk Radio.
Welcome to Partners in Health and Biz with your host, Gail Dixon. Tune in every Saturday, 9 a.m. for great shows about obtaining and maintaining health, business, and finance. Learn from the experts here at PIHradio.net. And now, broadcasting from the Partners in Health and Biz studio, here's Gail.
Well, good morning, everyone. Good morning. I'm your host, Gail Dixon. Welcome to the Partners in Health and Biz radio show. We are broadcasting this morning live from our Columbia, Maryland studio. Our topic today on Partners in Health and Biz is addressing minority mental health as we recognize July as Minority Mental Health Awareness Month. First up, a little news you can really use. In Baltimore, Maryland, opioid addiction continues to kill Marylanders at a record pace, with fentanyl driving the increase in overall doses in 2017 and in the first quarter of 2018, according to new statistics. An increase of fentanyl mixed with cocaine accounts for the increase in drug-related deaths, while the number of fatal heroin overdoses in Maryland appears to be decreasing after increasing exponentially every year since 2011. Fentanyl is a synthetic opioid that is more potent than heroin, and contact with just a few grains of the powder can be fatal. While Maryland is starting to see a decline in heroin-related deaths, fentanyl-related deaths continue to rise in staggering numbers, said Maryland Department of Health Secretary Robert R. Neal in the news release just this Thursday. In the first 3 months of 2018 alone, he said, we've seen 500 fentanyl-related deaths. We're asking those with a substance use disorder to immediately seek treatment and for more individuals to learn how to use and carry naloxone. And I don't know if I'm pronouncing that right. But here to address this topic this morning is my special guest, Dr. Kim Jones-Fearing. Now, Dr. Jones-Fearing is a board-certified general psychiatrist in the state of Maryland and has practiced psychiatry for over 20 years. She completed medical school at Howard University and her residency training at Georgetown University in Washington, D.C. Her treatment philosophy is that emotional problems should not stand in the way of living a rich, fulfilling life. Dr. Jones-Fearing believes that although the decision to seek help is a difficult one, the good news is that the vast majority of people can be helped with psychotherapy, counseling, and or medication. So without further ado, I'd like to open up the microphone for Dr. Kim Jones-Fearing and welcome her to Partners in Health and Biz. Good morning, Dr. Fearing. How are you?
Hello, Gail. How are you?
I'm great. Good to have you. So, this topic that we have this morning, Mental Health Awareness Month. July is Mental Health Awareness Month. And we're hearing so much on the news. People are committing suicide and depression is going up. So we would like to ask you as a psychiatrist and professional, why is the suicide rate going up? Could you tell us, do you have any information on that?
Well, that's a very good question, Gail. I don't think anyone knows the entire reason why the suicide rate is going up, but we do know some facts. Overall, since 1999, the suicide rate in all 50 states, except with the exception of Nevada, have experienced an increase in the suicide rate, and it is approximately in half of the states it has gone up more than 30%. And the other half of the states, it's gone up by overall about 25%. And Nevada was the only exception. They had a decrease in the suicide rate of about 1%. However, their rate of suicide is still overall higher than the other states. And we just don't know all the reasons for it, but we also know that the death rate from opioid overdose has also gone up. And there is at least one study out of Johns Hopkins, the Bloomberg School of Public Health at Johns Hopkins, that has shown that the death rate from opioid overdoses, the death rate from suicide has been shown to the reason. Let me put it this way. The number of people who have opioids in their system at the time of suicide has doubled over the past 2 decades.
Wow.
And so
okay.
we think that they may be actually linked. And another possible reason for the increase in suicide rate is that in the United States, we have seen a rise in the suicide rate, whereas all of the other developed countries, they have actually seen a decrease in the suicide rate. And so we think that it may have something to do with the way that we deliver care in this country. So that may be part of the reason.
Okay, so the suicide rate is going up, and the rate of drug overdoses are also going up. So, do you know why the rate of drug overdoses are going up? And I know that the two are connected, but the rate of drug overdoses are going up as well. So, what is causing the actual specific rate?
And that's a very good question. Over the last approximately 5 years in Maryland, the rate of drug overdose deaths has increased, and that's in spite of many tasks that we've undertaken as doctors and in public health. We've created a prescription drug monitoring program so that what happens is when people are getting opioid-based prescriptions, it's being tracked. And it's being tracked so that doctors can realize when people are starting to get in trouble, when they're starting to receive opioids from different doctors and different healthcare systems that normally may not have a lot of opportunities to communicate with one another. And we've been able to intervene and detect better when people are having problems. And we thought that this would be helpful since it has been shown to be helpful in other states. But what we're finding in Maryland is that even though we've instituted the prescription drug monitoring program, what we've seen is an increase in the overdose rates of opioids. And what we think might be happening is that when people are being noted to be receiving multiple drugs from different doctors, instead of the problem being addressed, what's ending up happening is patients are often discharged from treatment, and what happens is then in theory, they may be going to street drugs instead of receiving drugs from their doctor, and the street drugs can be laced with fentanyl and all other kinds of impurities, and we think that may be leading to overdose deaths. And another thing that we notice very commonly in psychiatry and public health in general is that when people do receive appropriate treatment, rehabilitation. As soon as they get out of rehabilitation, that is when they are the most vulnerable to overdose from opioids, because their tolerance level has decreased dramatically as a result of being clean and sober over the month or several months that they're in rehabilitation. So that can be actually the most vulnerable time for them at the time when they leave the structured program of rehabilitation.
Oh, okay.
So we think that people are going to street drugs when they when they no longer have access to the drugs they may be receiving from their physician.
Okay. So that's I see the connection then between these two statistics, how they can be related at some point. If someone is going to street drugs and they're not getting the proper medication, and then I guess they get to the point where they get depressed, and then they turn to suicide. So I can see that the connection there. Yeah.
And so, I think in our community, as well as all across the nation, all communities, all races, everyone knows someone that has at some time in their life had a drug addiction, and how that usually plays out is when there's a person who has an addiction in the family, there's often drug-seeking, crimes committed, people turn to stealing or other crimes in order to support their habit. And in doing that, they often end up abandoning other family members, or other family members start to reject them due to their baggage and their dishonesty, and all of those things are actually part of the disease of addiction. And the best approach is to treat the entire family, not just the addict. The entire family needs to be treated. And there are self-help programs that are available that I will talk about later in this segment, such as Nar-Anon and other programs.
Okay. So at this point, I would like to give out the call-in number to Partners in Health and Biz. You are listening to Partners in Health and Biz. I'm your host, Gail Dixon. My special guest is Dr. Kim Jones-Fearing, psychiatrist, and the topic is Minority Mental Health Awareness, addressing minority mental health awareness. The call-in number this morning is 347-945-7433, 347-945-7433. And so, Dr. Fearing, we understand that there seems to be something going on, a difference in how people are treated, and we hear the word healthcare disparity. What is a healthcare disparity?
Okay. Healthcare disparities are preventable differences in the burden of disease, injury, violence, or opportunities to achieve optimal health that are experienced by socially disadvantaged populations. And so what that means is that there is more morbidity and mortality in the African American and Hispanic communities than there are in the majority populations in this country. And also there is less access to health care, particularly mental health care. And we don't always know the reasons for all of these differences, but there are several programs that are set up to do research and try to find out what kinds of things work in order to decrease these disparities. And some of the things that are effective